My name is Gina Armengol, and I'm going to be presenting what it's been my master's thesis that I conducted at the Free University of Amsterdam in the Netherlands, together with the University of Calabar Teaching Hospital in Nigeria. There, we're trying to assess the feasibility of introducing perioperative blood salvage devices in obstetric care, focusing in tertiary hospitals in Nigeria from a stakeholder's perspective. Nowadays, there's still mother who loses their life due to preventable causes. And this is no different from Nigeria, who actually holds one of the highest maternal mortality ratios in the world. Actually, in 2017, it was estimated to be 576 deaths per every 100,000 births. Postpartum hemorrhage accounted for more than 27% of those deaths. There's also other sub-Saharan countries that also face high postpartum hemorrhage are also facing blood bank shortages. A good alternative of using allergenic supplies is to use the perioperative cell salvage, which consists of collecting shed blood during surgery and postoperatively processing it and reinfusing back to the patient red blood cells. Its indications in obstetrics are quite wide, which could help reduce the maternal mortality rates. However, in Nigeria, its use rates appear to be quite low. Some of the reasons could be due to socio-cultural factors or related to the health system. There is lack of evidence on the reasons for the low cell salvage implementations or the way to improve its use in Nigeria. This research has attempted to fill this gap by assessing the feasibility of cell salvage services in tertiary hospitals in Nigeria from a health system perspective. To do that, we use the framework of health systems performances of Murray and Frank, together with another performance framework. These are 4 different functions of the health system. The stewardship domain sets the direction of the health system and the rules involving all actors. The service provision refers to the provision of the services in obstetric care, and in this case of the cell salvage, and also the communication between departments. Research regeneration refers to the production of more tangible things, that it could be the cell salvage devices, but also the knowledge and the training of the staff and the people that need to perform this technique. Financing refers to the general financing of the health system, but also to the cost and the cost effectiveness of the technique. Our study setting was in the University of Calabar Teaching Hospital. Why there? Because they are front runners of the bloodless medicine surgery, and they also hold an interest in the development of blood salvage products. Our study population was everyone involved in blood transfusion and in obstetric care in tertiary hospitals in Nigeria. For that, we purposely sampled from the framework that I just presented to you, and we conveniently selected those participants with the help of key informants in Calabar. The data collection had 2 different phases. The first one consisted in the stakeholder identifications of those that could be involved in the introduction of cell salvage devices in tertiary hospitals in Nigeria. And the second phase was to perform 12 semi-structured interviews of the people that we conveniently selected. For the data analysis, stakeholder, we used the transcript and created a stakeholder power interest grid. And for the semi-structured interviews, we used the program Atlas TI, in which we deductively coded from the framework, and those that didn't fit the framework, we inductively coded them. This is a table of the characteristics of the semi-structured interviews, the participants. Moving now to the first part of the results, the stakeholder analysis. Here you can see the grid in which the stakeholders are placed depending on their interest, meaning the motivation to introduce cell salvage devices in tertiary hospitals in Nigeria, and the power to having the availability to mobilize resources to do so. You can see here in the top right corner that we had the hospital CEO and policymakers as the main stakeholders, key stakeholders. We also had healthcare providers that could perform this type of technique, like anesthesiologists, obstetricians, and surgeons. Some other relevant stakeholders are professional associations in Nigeria, such as the Society of Gynecologists and Obstetricians in Nigeria, SOGON, the Nigerian Society of Anesthesiologists. We also found that the Bloodless Surgery Group in Calabar and the International Bloodless Medicine Society were also key stakeholders that could get involved. Moving now to the findings of the STEM instructor interviews in the stewardship domain, we found across all interviews that the presence of an advocacy group, as you can see here, and in the comment, an arrowhead or a group of people who would be willing to promote it to the management and demonstrate that it would be feasible and important, it was key to succeed. A group that could do that was the Bloodless Surgery Group. However, it was mentioned that it's still an infancy stage and more needs to be done. Linking into that is because the government doesn't has as a priority to improve the current situation of blood salvages. It is actually doesn't have a place in the new enacted law. This is why it should be a bottom-up approach. Contrary to these comments, it was mentioned that if it wants to be sustained over time, a policy scheme is actually needed. Moving now to the financing domain of the framework, it was mentioned that having a high cost of the devices would be acting as a barrier, as a constraint, that usually the manager doesn't look at the long benefits, and it looks more at the short benefits, as you can see in the comment below. And contrary to that, it was mentioned it was in a more acceptable price. Sometimes the management, even if it's expensive, the benefit can outweigh the cost. This is because most of the Nigerians are not insured, and having really expensive things that are not affordable, it would be acting as a barrier to its implementation. Moving to the research generation, it was mentioned that having training to the users would be key to ensure its feasibility. Most of the people would be willing to get trained, but more important, not only the users, but the people who can fix it, like engineers, was key to succeed. Having something that it's brought to it should be fixing, matching the context where it's brought. So bringing a thing that if it breaks, people cannot fix it or don't have the spares, would be acting also as a barrier. So we should be bringing things that are fit for purpose, something that can be fixed with the engineers and with the things that can be found in the local context. Moving to the service provision now, it was mentioned that people in tertiary hospitals in Nigeria, users, surgeons, obstetricians, and anesthesiologists could actually perform this type of technique. And when asking if midwives could do it in another context, people were a bit more reluctant about that. A facilitator also was mentioned that end users, people that will receive the blood, would be more willing to get their own blood than another person's blood. Overall, this was perceived as a thing that could be improving the current situation of blood shortage in Nigeria. And the only cultural issue that would be acting as a barrier would be some people sticking to the old ways, but this is something that could be overcome with training and education. To conclude, this research has provided an overview of the perceptions on the feasibility of cell salvage in tertiary hospitals in Nigeria, and also the stakeholders that need to be taken into account. The main factors, the key things that we found is that an advocacy group, a champion, should be advocating of it. It should be affordable, not really expensive. Spares should be available in the local context. Training of the users and technicians is key to succeed, and a lot of education on transfusion alternatives. We hope that this is a call of managers to tertiary hospitals in Nigeria and also the government to consider these types of technique, and further research needed with a wider populations and with other type of perspectives.